Buffalo is a city of incredible grit, but it also holds some of the starkest economic challenges in the nation. Yet, on the city's east side, a remarkable narrative is unfolding. Health Sciences Charter School didn't just set out to be another place of learning. It was built to be a direct pathway over barriers, transforming a 90% economic disadvantage into a 90% plus graduation rate. This isn't just a school, it's a launch pad.
Well, health sciences was a collaboration of the different hospitals and foundationally the health insurance planners. They came together along with David Palmer, who was our first board president of the CWA, with the idea that there's going to be a healthcare shortage. And they also wanted to address minority and underprivileged students to be able to get into this healthcare pipeline. So they were able to get approved as a charter and started in 2010. They started in Tonawanda at the Sheridan Parkside Community Center. And then they traveled and moved to the current building we are at 1140 Ellicott Street.
The building wasn't even fully renovated at the time. The only floors that were in use was the ground level, first and second. Third and fourth were like a skeleton. No rooms, no offices, no drywall up, no ceiling, no anything.
What started as a new educational model quickly evolved into a grassroots community movement. By opening its doors and aligning with the heartbeat of the East Side, Health Sciences earned the trust and embrace of a neighborhood ready to see its young people lead the way.
One of the big reasons of what we tried to build up here in the community, we tried to cater right to the community and what's important in the community. So athletics is a big component of what's important here. So the people that we hired and coaching in that became an atmosphere. Another major part of it is the medical niche, right? We're like one of the only schools around that are mandating or asking, providing the opportunity for people to go into healthcare. So that's a unique niche, especially in this early age. And then the big thing, we're affectionately known as the only historically Black high school in the area. So that unique narrative on the east side of Buffalo is kind of allows people to gravitate towards us.
The energy on campus is undeniable, but the purpose driving it runs much deeper. Behind the school spirit and the daily routine is a stark reality. These students are fighting against the odds every single day. Actively reversing those odds isn't just an achievement, it's a lifeline.
So everybody who knows if you live in Buffalo, sometimes my parents were so good, you didn't know you were being raised in poverty, right? But Buffalo is the third poorest city in the nation. And then it's a different type of poverty because it's a concentrated poverty, as in those who live in the city, and concentrated poverty in the surrounding suburbs. There's definitely a larger increase in income versus within the city. So a 90-90-90 school deals with the fact that 90% or more of our students are economically disadvantaged or qualify for a free lunch, which is if you qualify for a free lunch, they consider your family below the poverty line. The second part of that, or 90% African American Latino students attend the school. And then the third part of that, in New York State, we have a 90% plus graduation rate, which is about 15, 20 points above the current district that we stand in.
That unique narrative created a powerful gravitational pull on the East Side. But keeping families connected required intentionality. It meant intentionally listening to the neighborhood, aligning with its passions, and creating a school culture where excellence in healthcare met a deep love for community traditions.
When people are genuine, and I think our school has a lot of genuine people who truly are here for the students. Because I tell people all the time, we have a lot of educated people in the building. So if it was just about a check or, earning money, although you have to, make money and have take care of yourselves and your family, there's other things that people could do outside of the amount of stress that comes with this, that people are in it for the right reasons. And I think people notice that because you can tell when people are faking it. So I think people appreciate us being authentic.
Facing those kinds of daily realities requires more than just academic instruction. It demands a relentless commitment to changing lives. And that commitment is carried entirely by the staff.
for us, it's a testament to the hard work that everybody does in this building, not just the administrators. It's from the teachers, support staff, the front office staff, everyone who works together to kind of make sure that dream happens, and that we do all that we can to prepare our students and now even their families to be able to navigate through something that's very difficult. So I think to be able to do that is a big deal. Like, you could say that we have high poverty, you could say that we have all minority students, but those aren't necessarily bad things. Definitely not having minority students is not a bad thing. But I think the connotation that people associate with that is what comes, okay, we talk about the poverty piece, but they have no control over that. So being able to still get these students who have so many things against them to still be able to walk the stage on time with their peers and kind of surpass the state average in terms of graduation is a very big deal. And I think it's something that we should all be excited about, but it's a testament to the hard work that everybody is doing in this building day in and day out.
And that hard work isn't just about grinding for a diploma. It's about building a place where kids can thrive. Changing lives means protecting a student's right to just be a kid, because while preparing them for big futures, it is just as vital to ensure they experience the simple, unforgettable joys of being a teenager.
That high school students just want a great high school experience. You know, they say they want to go in the medical field, but when I interview them, you know, they cared about their sports. They cared about the prom. They cared about what I call as a classical high school experience. And so it's our job to make sure they got those things, and then we can indoctrinate them to the different health careers.
But providing a safe haven and a classic high school experience is only the beginning. The vision for this community is actively growing.
In order to be the, premier charter school in Western New York and beyond, I think we have that expansion is key to be able to get students at a younger age where their foundational skills is what makes a difference for them when they get to middle school. And so instead of having to receive students in middle and coming straight out of middle school into high school, and we don't know, their learning experience, what they've been through, how they learn, we have more time now to be able to do that and to kind of catch them and intervene early on. And I think it also gives an opportunity for families who do trust us with their students to say, okay, well, now I have an option to send my high schooler and my middle schooler and my kindergartner to the same school as opposed to being in different locations.
The vision doesn't stop at high school graduation. Health Sciences is building a true K-to-career pipeline, which means the commitment to these students doesn't end when they cross the stage. Even after they leave these halls, alumni can always come back to access CTE programs and earn the certifications needed to build lasting, successful careers.
The Healthway building, I'm pretty proud of that achievement. That's a building, separate building from our main building, where we're able to go over there and it kind of focus on the arts, and then it's also focused on the different CTE and certification programs in the healthcare industry. And I'm pretty proud to announce our alumni are able to go over there and take advantage of our current phlebotomy class. They can go there and it's being paid for, like one of our partners, $11.99 SEIU, the union. And so we're fulfilling our mission of being a K through career school, and Healthway, that building is a major part of it.
New buildings and broader pathways represent an exciting new chapter, but the core mission remains a constant. Even during a season of massive expansion, the daily motivation never wavers.
But if they want somewhere where they can be certain that their child will be safe and well taken care of and that they're learning, this is absolutely the place to send your child. And I think that we have parents who would say the same thing. We have current families, former families, all of that, who will say that it's a true investment. Like, we're not just here to just be here. We want to make a difference in our community for our students and give them the opportunity, because a lot of it is not necessarily that they don't have the ability, it's really that they need the opportunity and the exposure, and that's what we're trying to give them. So I would say absolutely, if you want your child to be safe, you want them to be loved, and you want them to learn, the Center for Health Sciences Charter School.
Yeah, the K through career vision, Healthway is an extension of our high school where alumni can come back and take advantage of different programs. But we also want to extend that to the community, right? If you want to go through a career change or you want to upgrade your skill sets in healthcare, we want them to become able to take a part of that. At the same token, we want people to feel like that's our school, that's our community, that's our school. I want to send my kids there, right? And I can go there too if I want to. And so we want the whole vision of a community school that literally is going to help people from K to career to community.